So this week is all about hands. It's no good our skin looking great on our faces if our hands give away our age.
Okay, so for those of you that aren't familiar with Profhilo, it's a very unique treatment, and it's an injectable hyaluronic acid, and it's used to treat laxity in the skin, loss of hydration, so loss of that hyaluronic acid that makes our skin really plump and hydrated. And it also stimulates collagen production, basically an all-rounder for any aging skin. You can use Profhilo in the face, the neck, the décolletage, the backs of hands, which is what we're focusing on today, and pretty much anywhere, upper arms, tops of knees. It's a really versatile treatment. So let's talk you through the treatment. We first of all numb the area with some nice numbing cream to make it a nice comfortable procedure. And now you can see, so the skin's been prepped with local anesthetic cream. That's all been removed and cleaned. I like to mark the area that I'm treating because it gives me a visual on somebody's kind of anatomy, and in this case, especially the vessels, because we want to try and avoid any bruising of the patient. Everybody does their treatments differently. I like to really adapt my treatments and administer it in quite an artistic way, in the sense that I kind of work and apply and inject volumes in areas that I feel that particular person's hand requires. So you can see I've kind of gridded out, and now you can start to see the injections. It's a very, very thick hyaluronic acid, so it's quite hard to push into the skin. You have to do it very slowly and very gently, and you can start to see the raised, you're looking for a nice raised bevel. I like to call them half Maltesers. They don't always look that neat, but like a nice little half Maltese or a little lump underneath the skin, and that shows that you put it nice and superficially, and that's where Profhilo needs to be. These little lumps that come up, they don't last very long at all, anything from a couple of hours, maximum a day, and they all completely disappear. You can see sometimes you do catch a little capillary. That's obviously normal. You're using a needle in the skin. But as you can see, when we finish the treatment, you're just left with rather strange looking hand. I always get my patients to remove their jewellery just in case they did get any extreme swelling. I like to clean off the area, make sure there's no bleeding, and then seal it all off with a protective seal spray specifically designed for the skin called Dermaseal. And that's it really. And you do 2 of these treatments 4 weeks apart. I like to work with that protocol, and then that treatment can last anything between 4 and 6 months. It just leaves you with really lovely, hydrated, smoother, softer looking hands, and it's a great treatment for people that really feel that their hands are letting them down. So that's Profhilo. If you want more information, please go to our website. We've got plenty of information on there and more videos about it.